This Thursday, March 7th, the Joint Select Committee on Social Services and Public Administration invites you to share your insights on experiences in the public healthcare sector, specifically regarding non-communicable diseases. This Morning Now shines a spotlight on how your voice can help shape a healthier community.
Shogwanas, it's your turn. The JSC on Social Services and Public Administration is coming to Centrepoint Mall, Shogwanas for its town hall meeting on public healthcare services and you. Come out on Thursday, 7th March at 4:30 p.m. at the Southern Hall of the Centrepoint Mall, Ramsaran Street, Shogwanas. Come, give your views on combating non-communicable diseases, the effectiveness of the Chronic Disease Assistance Program, CDAP, the standard of service received at outpatient clinics, and the overall public healthcare system. Let your voice shape your future. Come out to the Southern Hall, Centrepoint Mall, Ramsaran Street, Shogwanas on Thursday, 7th March at 4:30 p.m. For more information, call us at 624-7275, extensions 2283, 2427 or 2277, or email us at jscsspa@ttparliament.org. The Joint Select Committee on Social Services and Public Administration, Public Healthcare Services and you.
Come lend your voice because we are talking health and you. And this morning in our spotlight, lending a voice on behalf of, or rather, as the chairman of the Joint Select Committee on Social Services and Public Administration, Senator Dr. Paul Richards joins us on the Now Morning Show. Good morning.
Good morning, Ainka. Good morning, Natasha. Good morning to all of your team. Good morning to your control room and Hoodie Spolany.
Always a pleasure to have you back on set.
Well, yeah, thank you for having me.
Well, it is necessary because this isn't the first of its kind, but it is a continuing and necessary conversation. Tell me a little bit as to why these town halls are held, because there's so many other options. We have people talking on social media, we have persons coming into office, but town halls remain. Why is that?
Because I think people, good morning once again and good morning to your audience, and thank you for having me / us at the Parliament of Trinidad and Tobago. I think town halls are important because they give people a sense of ownership of issues in the country. Very often you hear the lament, well, people have no power, my voice doesn't have any power, I have no real impact on what's happening in society. But that's not so. People think, well, it's only every 5 years when you're voting, you have a say, you have your own vote. But there are several opportunities in society, and in particular related to the Parliament, to have your voices heard on very important issues that affect the public, you, the public. And health is one of the most important issues affecting anyone. Without health, you really have nothing. You see a different side of life.
Right.
So this inquiry that I have the honor to chair the Joint Select Committee on Social Services and Public Administration, and we explore several issues facing the population in Trinidad and Tobago. In this specific instance, we're looking at the public healthcare system. We're looking at NCDs, which have the most impact on the society. It's the biggest negative impact on health in the country, in the world for that matter. It has the biggest drain on the healthcare system in terms of the money spent at health interventions. And in particular, in this case with NCDs, cardiological diseases, heart diseases, cancer, and diabetes. I mean, that is the trifecta right there. So we very often with the Joint Select Committees, we have stakeholders like the Ministry of Health, we have the Nurses Association, we have the Cancer Society, but we also think it's very, very important to get the public's view and how the public is experiencing its interface with the public healthcare system. And we know we get a lot of negative comments and bad news. We've had two before, one in Port Esprit, the Parliament building, and one in San Fernando at City Hall in San Fernando. But interestingly enough, it's not all bad news. But of course, there are some challenges.
Right.
And we are giving people the opportunity to tell us of their experiences in the public healthcare system, so that when the committee finishes its inquiry and we create a report, we present it to the Parliament, and hopefully the recommendations are taken to make the system better for you, the public.
Right. Now, I'm glad that you mentioned the locations that there have been two. We've covered the north, the south, we're central now. You've described that there has been a lot of negatives, but a lot of positive feedback. Have there been particular distinctions in terms of those challenges, north versus south, or has it been similar across the board?
They've been very similar, but of course, each RHA, the Regional Health Authority, will have its advantages and disadvantages. Some serve more, some serve less.
Right.
So the load on some may be more. Depending on the population density and depending on the kinds, interestingly, the kinds of diseases that are presented to the healthcare system in terms of interventions and challenges and the systems in place. So there were some slight differences, but more or less the same positives and negatives.
Okay. And granted that we are on the 3rd, we can expect more coming to the country
We
at
hope
different
so.
locations. Yes?
Yeah.
All right. So that this one is, yes, geared towards or located in the central area, but persons from environs are encouraged to come
Absolutely.
as well. Now, tell me a little bit as to the committee itself, comprising of a number of authorities and, as you mentioned, stakeholders, I imagine, being represented, so that the public has an idea of who they're speaking to, not just Dr. Paul Richards, but a few others, yes?
Yeah. Well, I just chair the committee / manage the committee
Right.
as they are constructed in Parliament. So we have member Penelope Beckles, who is also a minister. We have Esmond Ford, who is the deputy chair of the House of Representatives. We have Vandana Mohit, who is an MP. We have Senator David Naked. We have Minister in the Ministry of Agriculture, Avinash, Senator Avinash Singh. So we all make contributions in different ways. And because the committee is so composed, it's government, opposition, and I'm the independent, it's really a bipartisan, it's a multi-sectorial approach, and believe it or not, we work together very, very well in terms of exploring the issues. So contrary to what there's a perception that, well, government and opposition always clashing, that's not necessarily so. You see a lot of great work behind the scenes and in front of the camera sometimes with the Joint Select Committees in terms of inquiries in all the committees.
Well, we do definitely know that you're working towards a common goal. So there is the need to put any sort of differences aside. But then tell us, in terms of specificity, what is the significance of these persons being on the board? Yes, we understand politically where they come in, but in terms of expertise, you also mentioned other stakeholders. So do we have representatives there, nurses associations, and those who will be present at these town halls?
They're always invited because their input and their experiences are also valid in terms of them working in the healthcare system and the challenges they may be experiencing or the facilities they may be having at their disposal to provide healthcare services. The Cancer Society, you understand, the Diabetes Association, all the stakeholders are very, very important in adding their voices, and also, to me, most importantly, not negating the importance of the stakeholders like the Cancer Society and Diabetes Association, the general public. Every day, Mr. and Miss Trinidad and Tobago, to me, is the most important voice that we want to hear from, because it's important. We can have the stakeholders, we can have the Ministry of Health, they look at it through a particular lens. But the public, when you are ill or your family member is ill, it's one of the most vulnerable times that you're experiencing in your life. You want a particular standard of care. You want a particular interface. You want a particular processing of your system or your family member through the system. So I think getting the public's perspective and experiences is very, very important for making recommendations for a better healthcare system.
So we have an idea of who's there, why we're doing it. Tell me a little bit about the actual execution. Persons are going to come into a hall and a head table is facing them. I understand, as you mentioned, behind and in front of the camera. So there will be some sort of recording or presence of the media. Describe to me what one can expect on site.
The hall is very welcoming. You know, we have people from the Parliament will welcome everybody in. Some people, if you want to be registered, you can be registered. If you want to remain anonymous, you can. There are seating arrangements, there are light refreshment. The committee is seated at a table. We introduce the committee to start. Very often we have somebody from the RHA in a particular region, one of the doctors, give an overview of NCDs. Because it's also with a view of looking at the CDAP program and how it's working, and the general healthcare service in Trinidad and Tobago. And in particular, the importance of looking at NCDs, cardiological disease, cancer, and diabetes, which are quite prevalent in our society. So that's the usual introduction. At that point, we open the floor. and people come to a microphone, two microphones standing, and you can give your name, you can decide you want to remain anonymous,
right.
and you give your experience in a particular area of healthcare. Very often, we've had very complimentary responses. People say they have made great experiences in particular areas, but very often there are challenges.
Right.
And we the last one we went to in San Fernando, there was a gentleman who was in glowing praise of the healthcare service, believe it or not. He said his experiences, and he's an elderly gentleman. Very good, the responses are good, the follow-up is good, the interface with the nurses, the doctors, very good. But then there are people who, for example, a woman came and she spoke about her really poor experience because she has a family member who has a disability, and her interface wasn't really good at all. So documenting this information and giving feedback and providing recommendations from the public, how they are interfacing with the healthcare service, is very important in trying to provide the state government, the Ministry of Health, with the information they need to improve the service.
Right. We will get to that documenting and sharing process just a little bit, but I do want to touch on the outpatient clinics, as it is separated in terms of one of the 4 areas of focus. What exactly is the findings, or what do you hope to find from on this particular matter? When we talk about outpatient clinics, we're talking about the community clinics and the actual experience of appointments, keeping those and going forward. Have there been significant challenges or complaints there?
But the interesting thing is it's twofold. One, I think more needs to be done in terms of the Ministry of Health letting the public know what is the reason for going into a hospital and as different to a health clinic in your community. And very often people, as a default, flock to the hospital because they think, well, that's the care I want. I'll get immediate intervention. And very often what people go to the hospital for, that's part of one of the feedback we've gotten. They can go to a healthcare clinic in their community and get proper intervention. And if there's a reference needed or a referral needed to the hospital for more intense intervention, that can be done. So I think that's some of the feedback we're getting. I think people need to get a clear understanding of what services are available and where they can get them to make the whole system function more effectively.
That's a very beautiful point, because I'll admit I didn't know myself. And
well,
so there is
I didn't know either. I actually didn't know either until I got the feedback.
A lot of opportunities to learn there. And so even if you're not necessarily contributing with a question, it's fine to attend simply to receive the information, yes? All right, so one of the other details that you've underscored is the non-communicable diseases, and you were mentioning the intention to document and share that with Parliament. Describe to us a little bit as to how that is done so that we, the public, have that reassurance that, as you see, our words are not falling on deaf ears.
Well, the good thing about it is that the way the Parliament is structured, they have a lot of experience in joint select committees and carrying on these inquiries in national security, in health, in social services, and education. So what happens is the committee decides on a series of inquiries for the parliamentary session or parliamentary term. The ones that are most pressing in terms of what the committee decides as a collective is important to inquire at that time. Sometimes something comes up that the committee didn't plan, and we say, well, this is a burning issue, that we need to pivot and make an inquiry. Sometimes they're short, sometimes they're 6 weeks, sometimes they're 8 weeks long. We deal with stakeholders first to get the feedback from the state as to what they're experiencing, the doctors, the nurses association, the ministries themselves, the permanent secretaries, the technocrats in the ministries, and they give us feedback from their perspective. And then we go to the stakeholder groups and the NGOs, etc. And then in many cases, the public can, through social media and through these kinds of outreach programs that we're doing now, San Fernando, Port Spain, and Centrepoint Mall this coming Thursday, the public gets a chance to weigh in on what is happening and how they feel about how the state is providing services in any particular sector. After all the information is collected, the committee sits as a collective and discusses, well, with the fantastic support of the Parliament staff, because they have we get a lot of support from them in terms of putting the information together so that the committee can discuss it as a collective and come up with how they want to present the final report. It goes out for several different iterations of comment to the members of the committee, and then we decide on a particular final draft of that report. In some cases, some members may disagree. It's a democracy, and they may present a minority report. And that's fine, because we want everybody's voice to be heard. Some people may not agree on everything in the final document, but very often, more often than not, people sign off on what the document is, and that final report is presented to both the upper and lower houses and different sittings department, and are able to be accessed to by the public for public comment and public consumption.
Right. That latter part, I'm sure, is where everybody's going to flock to, simply because I want it to be granular to make sure we have the transparency, the complete understanding, and the value of what is taking place come Thursday at 4:30 p.m. at Centrepoint Mall. Now, one of the things that struck me was also the fact that it may be televised or at least recorded. So this means that it's going to be streamed live or shared live, so that if you don't want to physically be there, you can still participate.
But we want you to come, but we've also provided the facility that it's broadcast live on the Parliament channel and streamed on the Parliament's YouTube channel. So, and people who are looking at it on the stream can also provide comments, and we take those comments and actually disseminate it to the wider public.
Beautiful.
So there's a whole integration of different types of platforms working together for public, as you say, transparency and accountability.
Beautiful to see. I'm going to segue a little bit because I think we've given the people what they need to know so that they can come on down at 4:30, from 4:30 to 7:30. That is the 7th of March, making sure they get their voices heard. But let's think about the season that we're in, holidays, even persons who are still enjoying the benefits of cruise ship season. Do they benefit from these sorts of forums as well, in terms of physically attending or even contributing? Are their words taken into consideration as well?
In terms of people visiting the country? Yeah, absolutely, because visitors to our shores, who we welcome all the time, there are several cruise ships coming in all the time now, sometimes need healthcare interventions. So their experiences are very important. You know, we have registered and unregistered migrants in Trinidad and Tobago who will need medical intervention from time to time. We welcome everyone who has, and let's face it, everybody at some time will have to interface with the healthcare system in any country. You know, and particularly the public healthcare system, which in every country is overburdened because healthcare is expensive. We have the luxury in Trinidad and Tobago of having primarily free healthcare through the state.
And so we definitely want to make sure that we head on down to lend our voice and make sure that we improve that system so it continues to serve us as effectively as it already does. Let me say thank you most genuinely, not just for joining us in the early hours, but for making sure that we understand completely the necessity of the town hall meetings, and of course looking forward to the outcomes. As Senator Dr. Paul Richards joins us this morning in his capacity as chairman of the Joint Select Committee on Social Services and Public Administration, tackling public healthcare services and you. For more information, of course, you can check them out on social media, online, through the Parliament channel and other methods. But for now, guys, we will continue conversations that you need to hear. So stick around. The Now Morning Show continues after these messages.
I am a lion, and yes, I'm a fighter. For my book, yes, I'll be the writer.